So I'm a physician assistant or associate. I've been doing this for a little over 20 years, and also hold a doctorate in health education. So one of the things that I do is I work within the predominantly African-American community in Southeast in Washington, D.C. That's Ward 8. And that particular area has got one of the probably one of the most socioeconomically challenged areas, as well as health-wise. So I see a lot of kidney disease. And one of the things I'd like to go over is first some anatomy of the kidney. So this is a model. I tend to be a visual learner and teacher. So the kidney is actually quite large. It's about the size of your fist. However size you are. So if you're a child, it's about the size of your fist. If you're an adult, it's about the size of your fist. And they sit what we call retroperitoneally in the body. Retro meaning back, and then peritoneal behind the peritoneum. So behind the intestines and the liver and the abdomen. And that's why it hurts when people get kidney stones. They say that they have extreme back pains, and these are things I see in the emergency room as well as in the clinic. It also has some things attached to it. So on the top, there's the adrenal gland. We all probably know about adrenaline. So this gland also secretes other things, aldosterone, different androgens, your sex hormones, and cortisol. So I won't go into the adrenal gland, but it's important because there's something called the renin-angiotensin system. That's a physiological component of the kidney. But just sticking with the kidney, on the inside of the kidney, there is it's a spongy material, and you've got something called the medulla. So you can see these things with the naked eye. So one of the things that I've done is post-mortem procedures. I did this about 30 years ago. So that's autopsy. When a person dies, we autopsy the body to find out why they died. But you cut the kidney open, and you'll see this medulla and renal calyces inside of the kidney. And also attached to it is I don't know if everybody can see that, but there's vasculature. So there's the renal artery and the renal vein, and then the ureter. So the ureter is attached to the kidney, or to the bladder rather. Again, with kidney stones, something that I see often is people will have back pain, and then it will turn to abdominal pain because that kidney stone is traveling down the ureter toward the bladder. But that's on the macroscopic level, so you can see that with the naked eye. On the microscopic level for the kidney, there's something called the nephrons. The nephrons, there's about 1 million nephrons in the kidney, and this is really the filtration component of the kidney. There's something called the glomerular body, the glomerulus, and it is a fenestrated or perforated organ. It's very, very small. You need a microscope to see it. And it filters all the liquid stuff through our body. So blood, things that we drink. It's got the fenestrations or the perforations in it because of the filter. It's not supposed to let large proteins through. So you may hear people get a urinalysis, and the doctor will say, "Oh, you've got a lot of protein in your urine." Well, you're not supposed to, because that glomerular body is supposed to be keeping that in your body. There's also something called the loop of Henle. You probably can't see it on here, but I can put this up to the screen. This is kind of a blowout picture of it from this kidney. So the loop of Henle, and that's where a lot of the absorption of different minerals take place. It's also a site of action of a lot of the medications that people are given when they have things like high blood pressure. So you may hear people being on a water pill. This is Lasix. This is what we call a high ceiling loop diuretic. That works on a particular portion of the loop of Henle. Makes you urinate a lot. So this is things that we give people who've got CHF, congestive heart failure. They've got a lot of edema. They're retaining fluid, so we give them water pills to make them urinate. That acts on the kidney. Physiologically, that's the physiological component of the kidney. We also look at things like BUN. When you get your lab work, the doctor says, "Oh, your labs look good." your kidneys are working. They're looking at something called the BUN, or your creatinine levels. And if they've done a urinalysis, they may look at the protein levels. Hopefully you don't have protein in the urine. They also look at things like white blood cells, red blood cells. I've had patients complain of having blood in their urine. We call it hematuria. That's based on the pathology of the kidney. There's something called the GNC guidelines, the Joint National Committee. Every year, these are a bunch of experts in the field of renal disease or kidney disease. They get together and they talk about things like blood pressure in particular. Now we know Black folks, we're known for having a lot of us have high blood pressure. I had high blood pressure myself, and I didn't like it, so I had to make changes in my diet. I'm in that over 50 group, Dr. Ramadan. I had to be careful. I didn't want to go on medication. The Joint National Committee gets together and determines what constitutes high blood pressure versus normal blood pressure or low blood pressure. There's different categories of that. Things called hypertensive urgencies, malignant hypertension, hypertensive emergencies. And this is where you've got people on multiple blood pressure medications. I spend a good deal of my day when I'm seeing patients filling out prescriptions for blood pressure medications. We got to get those down because, as we all know, poorly controlled high blood pressure leads to stroke. And we also ask in the places where I work, I ask the patients if they do have chronic kidney disease or CKD. There's different levels. There's 1 to 5 different levels of chronic kidney disease. That's why we ask about urine output. A person may have something called oliguria, so that's small amounts of urine. They may have anuria, which is no urine at all. That's when you're in trouble. These are people that have to go on dialysis, and this is they've got kidney failure. As you were saying, Dr. Ramadan, the only cure for that, quote unquote, is kidney transplant. The way to keep them alive is to keep them on dialysis, and we usually dialyze patients 3 times a week. And I have to say this is interesting note. You go into a lot of inner city neighborhoods where it's mostly Black folks, especially where I work in the Southeast. There is a plethora of dialysis centers. That's a big money maker now. So again, people are making money off of our sickness. Nvidia, I think, is one of the dialysis centers. And those are almost as numerous as the liquor stores in the inner cities now, just because so many folks have got poorly controlled high blood pressure. Their kidneys have shut down, so they have to go on dialysis to keep from dying, because the dialysis machine is it's doing the job of the kidney. I've seen people refuse dialysis and they go into something called toxic uremia, where they go into a coma. I saw this happen with Muslim brother. We had to try to revive him, but the kidneys do a lot of work. It's one of those gifts from Allah where like in Surah Al-Rahman, he says, فَبِآ إِلَىٰ رَبِّكُمَا تُكَذِّبَانِ. Which of your gifts of your Lord will you deny? So he's given us these wonderful kidneys, but we have to do what we can to take care of them. So I'll show this, but it's some of the diseases of the kidneys. So things like I mentioned, kidney stones. There's kidney cancer. I've seen that before. There's different types of kidney stones. There's we call them nephrolithiasis. There's also hydronephrosis, where there's a blockage in the ureter and the kidney backs up with fluid and becomes enlarged. That's something that's got to be corrected. So there's a lot I can say about that. I don't want to be too verbose. I taught this course at Howard University many years ago as a professor, and it was a 6-day module. So I've truncated what I taught in 6 days at about 10 minutes.